Hi, my name is Dr. Josh Cohen, and I want to talk with you about the 5 most common questions I get with regards to cataract surgery. Now, for a broader overview about why we do cataract surgery, how it's done, and your options for cataract surgery lenses, I'll refer you to a playlist I made with some specific videos to help give you a more broader overview of the procedure. But let's get into the top 5 frequently asked questions. The first is, does it hurt? And fortunately, no, it doesn't. We use topical anesthetics both in and around the eye, sometimes with the addition of what's called a peribulbar or retrobulbar anesthetic block, which is a nerve block of injected lidocaine and medications in and around the orbit of the eye to help control pain. But that's not always done by every doctor in every case. But regardless, you should not feel pain during surgery. You might feel some pressure, you might feel some liquid on the eye, you might see a bit of a light show, but generally sharp pain and debilitating pain shouldn't happen both during or after the procedure. Now, the second question is relating to pain, but oftentimes people ask, will I be asleep during surgery? Because the concept of eye surgery is certainly scary for everyone. And the answer, some people might find surprising, is no, you're not asleep during surgery, at least not typically. We use what's called MAC or monitored anesthesia care. And this is usually done under the supervision of either your surgeon or an anesthesiologist or anesthetic assistant. But generally, we give IV or oral medications to relax you, to control your anxiety so that you're comfortable and able to be compliant during surgery. But because the procedure is pretty quick, it's usually about 10 or 15 minutes in most cases, you won't need any sort of sedatives that will put you asleep or to assist with your breathing. No LMA, no intubation, nothing like that. We typically do not use general anesthesia. Now, we might give you some additional medications to make you sleepier, like propofol or more aggressive sedatives and anxiolytics, but generally you're relaxed and comfortable, but not asleep. Now, in office-based surgery, which is also becoming to be more common when it comes to cataracts, we can achieve similar levels of relaxation without the IV at all, just with oral relaxing agents like Valium or special melts that contain benzos and even anti-nausea medicines to help you get through the procedure. The third question people ask is, when can I get back to work and when can I get back to exercising? Now, of course, this will depend on your surgeon's recommendations and your own personal recovery, but generally, the recovery is pretty quick with cataract surgery, where most people are feeling back to normal within a few days. Now, visual recovery usually takes a few days, but it could take a week or more for your vision to truly stabilize. But generally, your vision should be functional within the first week. Now, I usually don't recommend patients shower the day of surgery, but I often recommend that starting after the first day, they can get back in the shower as long as you're not getting water directly in the eye. I also recommend that patients use eye drops as directed after surgery, usually a steroid and antibiotic eye drop with or without an NSAID for pain control and inflammation. And those are usually given at the time of surgery as well. And those can be continued up to several weeks after surgery. With regards to heavy lifting, bending over, and exercise, usually we restrict patients for about a week before they can return to those activities, but again, that depends on your risk and your surgeon's recommendations. I would say full back to normal before you can swim and everything else should be about a week or 2. Now, the fourth question that people ask, and sometimes this is the first, is what can go wrong, or what are the risks of cataract surgery? Fortunately, cataract surgery is one of the most commonly performed procedures and is incredibly safe overall. The risk of complications is pretty low, about 1% give or take. However, there are some side effects and issues that a lot of people encounter, and I'll just touch on a few of them. But a more detailed overview and discussion of side effects and complications will be reviewed in another video. But generally, the main things we worry about are surface-related problems like dry eye and irritation, glare and halos that can happen after surgery depending on the lens that's chosen, inflammatory problems, pressure-related problems, or more severe side effects and complications like an infection that thankfully is incredibly uncommon. Now, while most people tolerate the procedure quite well, there are some precautions that we might need to consider, like blood pressure problems or difficulty lying flat if you have breathing issues, and we might need some prior clearance or discussion with your primary doctor just to make sure that you can undergo the procedure safely. Now, the last question that people ask is, can this come back? And the answer is no. Once cataracts are done and the lens is removed, the entire lens structure does not regrow, so cataracts in and of themselves do not come back. But when cataract surgery is done, the lens is removed, the capsule that's left behind is polished, but sometimes there's little remnants of cataract material, small cells left behind, inevitably, even in perfectly performed surgery. And in about 25% of patients, those cells can continue to replicate and grow, and they can spread on the lens capsule or on the lens itself, kind of like barnacles on a boat, and that's called a posterior capsule opacification, or PCO, and the treatment for that is fortunately a quick and painless in-office procedure called a YAG capsulotomy. This is done usually weeks or months or even years after surgery. It doesn't take long to do, just a minute or so, and it can create some floaters as that debris gets scattered into the vitreous cavity of the eye, but it does resolve any sort of clouding or glare that can be a result of the PCO. So again, this is something that can happen after surgery. Some people call it a secondary cataract, but it really is not a return of the original cataract. Totally different pathology and something easily treated in the office. So I hope that helped kind of outline some of the 5 most common topics of discussion that I often encounter when I'm talking to patients about cataract surgery. If you found this helpful, please like and subscribe, and I look forward to hearing some additional questions in the comments below. So thanks again, and I will see you in the next one.